Okay, it's Dr. Buford. We're just getting started in your left shoulder here. Everything's magnified 30 or 40 times. We're looking at the biceps tendon first. And that's this tendon here running up between 6 and 12 o'clock on the screen. The biceps anchor here looks good. And then at the top of the screen where the biceps exits the shoulder, that looks good also. The rotator cuff's right behind it, and on the articular side, the cuff looks good. It's the bursal side primarily that we're worried about. We'll take a number 1 PDS and just use it as a marker stitch. As we look down around the rest of the shoulder, the glenoid here looks good. The anterior ligaments look pretty good. Can you turn the brightness up on the other? And as we look towards the back, the posterior shoulder here looks pretty good too. Yeah, good. So far so good. Inside the joint, we'll look around a little bit longer. If there's anything else inside the joint, we'll come back up on the video. Otherwise, the next thing you see will be the subacromial space. So we're going to place a little marker stitch just where we kind of assume the tear is based on your imaging. So we'll pass the needle right through. We'll take a marker stitch. Hold the camera, please. And we'll pass this purple suture through. This stitch doesn't stay, it's just temporary. And then once we get it through, we'll go ahead and switch positions with your shoulder and look up above the rotator cuff. So there's that suture going in. Pause. Okay, so this is our first look in the subacromial space. You can see there's some bursal tissue, and that may even be some torn cuff tissue. We'll decide in a minute as we take a closer look. It's torn cuff tissue, which is what we expected. Hold the camera. Hold the shaver, please. Pause. Okay, so here's the tear in the tendon. It's right where I'm working here. So we're going to keep working here. Actually, there's even more of the tear. So we're going to keep working here. We'll show you some more in a little bit. Okay, so you can see there's our marker stitch. And you can see how it's going right through the part of the tendon that's torn. You can see the tear here. So we're going to go ahead and pull the marker stitch. Go ahead and pull it.
All the way up?
Yep. And then we'll just open up the tear right here. You can see it actually extends back here a little bit. Hold the camera here. Pause. Hold the camera for a minute. Okay, so here's our spinal needle. This is where we're going to be placing the anchor down. Maybe a little bit more interior. It's right about there. So we'll go ahead and get that done, show you some more in a minute. Pull. Okay, so we've got our triple loaded anchor down. I just want to show you here. And it looks like the sutures closest to the back are going to be this black and white one. So we'll pull this out the front, which is to the left, and we'll put a grasper in the front. Nope, we'll put a grasper in the front. I have the suture hook. Grasper goes in the front. And then I'll take that, and so hold the camera here now. So we're going to place a stitch. I got it. Two hands on this because you got to hold real still. We're going to place a stitch right about here. Once I get a good idea of the image here. There we go. So right there. So you can see how we come through right there. I like that. Pause. Okay, recording. Okay, we're all done here. Here's our 3 sutures for the rotator cuff. They're tied and holding down the tendon to the bone right here. We've still got to place our PRP, so we'll get that done in just a minute. But I wanted to give you a good shot of the repair first. As I rotate your shoulder, everything here moves together as a unit. That looks pretty good. And we'll go ahead and make sure we can see exactly what we think we're seeing, and we'll get this PRP done in just a second here. A little bit of bursal tissue here. We'll take care of that. Okay, so I think this will be the end of the video. Okay. And we'll get you back to the recovery room shortly. Good luck to you now. Bye-bye. No. Brother. Okay. All right, so I need a spinal needle, and I need the PRP. Hold the camera just like that. Go ahead and take the needle off of that. Hold the camera there. Yeah, that'd be great. And then we'll pause.